Hi, good evening. My name's Karen Haworth, and I am interviewing today Dr. Mary Pellicer. It is good morning for Mary because she's over there in the USA, and I'm going to be asking Mary how our TBI protocol is different to the medical model. So I'd like to welcome you to this interview, Mary.
Thank you so much, Karen. It is morning here, but it's 8:30 in the morning here. What time is it for you over in England?
4:30 in the afternoon.
Nice. Okay, we have the whole pond between us. Yes.
Yes.
But back to your question was.
Yeah. Well, my question is Mary, that as sort of you and I know that we've in business and we've developed the TBI protocol, but it has come from the Institute of Study of Peak States, and why you got back involved with the Institute of Study of Peak States.
Yeah, that's really the reason I did get back involved with the Institute. Does have to do with TBI. I was worked with Dr. Grant McFedridge, who founded the Institute for the Study of Peak States many years ago, 20 plus years ago. And early at that time, I worked with him for about 5 or 6 years. And after that time, we were doing, foundational research into consciousness and how consciousness works. Just my own journey, my own personal journey. And as a physician, after that time, I pulled away and went exploring in other ways and other things, and have kept in touch with Grant over the years. And earlier this summer, I was having another chat with him, and he was catching me up on what was going on with the Institute. And he happened to mention that they had developed this TBI process that was having phenomenal results in patients and people who had undergone a traumatic brain injury and having significant symptoms from that. And that this protocol, working directly with the person's unconscious, was helping people resolve those symptoms. And now, as a physician, what I know in conventional medicine is that we're really, really good at acute care medicine and saving people's lives when they've had, let's say, a significant brain injury, maybe a fall, or a severe sports injury, a motor vehicle accident, those kinds of things that cause blunt force trauma to the head. And as far as, keeping them alive on life support if it's that severe. Also, TBI, there's a vast range of severities with it. In any event, for my work, mostly doing disability exams for Social Security over here, I see a lot of people who had traumatic brain injury. Sometimes it was diagnosed, and sometimes my sense was it hadn't been diagnosed, but a lot of the symptoms they were having that were making it difficult for them to function had not even been diagnosed or attributed to TBI. So there's a lot of morbidity, a lot of struggle with these people and suffering. And back to conventional medicine we have physical therapy, occupational therapy, speech therapies, rehabilitation, and they do some brilliant work, but it's often very slow, working with a person's brain and slowly getting them to get functioning back. And often these people plateau at a certain point, which is often with still quite a few symptoms and dysfunctionality. So there, as I said, a lot of morbidity, a lot of people suffering because traumatic brain injury happens to be quite common. So when Grant was telling me these results, I'm kind of like, are you kidding me? That's amazing. And because of that, and knowing the struggles of this group of people out there, really wanting to get out there and bring this cutting edge technology, consciousness technology, out to people who need it. the people that are suffering from TBI. So that's the story of how I got back involved with the Institute. I am now the medical director for applied research, which means I help take the absolutely brilliant discoveries that Dr. McFedridge and his research team are finding in how do we use consciousness and basically hack it at very deep level to address fundamental diseases and problems that people in society have.
Okay, and now you're getting on to your
Yes?
There you are. Yeah, there was a bit of a sound dip there. You were getting on to the next question, Mary, that I really wanted you to talk to me, about how the TBI protocol is different to the medical model. I'd really like you to explain that for us today.
Yes, I've sort of alluded to that. In medicine, in conventional medicine, basically we're working with the physical body, the physical brain, and how things change over time. So we know our bodies have this absolutely amazing, brilliant ability to heal. So for example, if I was to get a cut on my arm, I just take for granted that over some time that will actually heal, whether if it needs stitches, and bring it together to make the scar thinner, or if I don't put it, if it's a gaping wound, the body still heals it. If it doesn't, there's something seriously wrong. But in most people, a cut will just heal. So our body has this innate, built-in ability to repair itself. And what we do in conventional medicine is try to help those functions along. So let's just take, for example, an infection. Again, our body has this beautiful immune system, when it's fully functioning, is keeping us protected from getting infections, right? And what we do, let's say with a bacterial infection, of course, lots of antibiotics are used. That's not actually healing the infection, it's just kind of giving the body a little boost. But if our body doesn't have a functional immune system, antibiotics aren't going to help. Okay, and we know that from cases of many years ago, the story of the boy in the bubble that really didn't have an immune system, and he had to stay protected from everything because he didn't have that built-in ability. I'm getting a little off track, but in any event. So our body can repair itself. When someone has a brain injury, there is some innate repair that goes on, and our therapies are basically working with this body and the brain's ability to repair itself and tap into what's called brain plasticity, and retrain it to allow it to start to regrowing some of those connections with the neurons in the brain and recover functioning. And so, for example, let's say someone has problems with their speech and those cognitive abilities like that after a brain injury. So a speech therapist will go on and through training exercises start to repattern and get those neurons up and running and refunctioning. The same if it's a physical, maybe an arm is weak or there's decreased range of motion, perhaps there's a sensory deficit, loss of hearing or such. Things like that, it's harder to so for example, if someone is totally deaf after a traumatic brain injury, I don't really know of any therapy that occupational, physical, or speech therapist would have for addressing that. But it tends to take a long time, over time, basically repatterning and laying down new neural connections through this process of brain plasticity to regain function. tends to be a slow process in my experience. I'm not a physiatrist, so this is just my view of this of being a family doc and having seen some people go through it. But rehabilitation tends to be slow, and it does work to a certain extent, but often there's this plateau. So that's how it is in conventional medicine. When we're talking about consciousness, and this is what
Please tell us, Mary.
Yes, when we're talking about consciousness, and what I just adore about working in this field is we are tapping into our power as humans to manifest how we show up in the world. That was kind of a weird thing to say, but let me see if I can unpack that a bit.
I like the quantum physics.
Yeah. Yes. Exactly.
Yes.
And so
explanation.
If we talk from a physics standpoint, the way that conventional medicine works is basically following the physics from the time of Sir Isaac Newton. Okay, Newtonian physics, where there's this cause and an effect, and how we understand causality and how things work. It's really based on Newtonian physics, which works perfectly fine for a lot of things, but is a little bit slow. So if we look at then quantum physics and Einstein and his peers that brought in now 100 or more years ago, we're talking about different. They're not. The rules are different. So if you talk to a physicist talking about quantum physics and subatomic particles, there's this sense of what they'll call collapsing the waveform and probabilities, and of course the famous Schrodinger's box. So there's this sense that our intent as observers of what's going on affects what we're seeing. Okay? Now this, I believe, weirds out a lot of physicists that understand it. Is like, how can that... I mean, Newtonian physics is very comfortable. That's how we live. We understand that. Quantum physics can get a little bit weird, and there's things that Einstein would call spooky actions at a distance, in the sense that as observers of physical phenomenon, we can affect that with our intent. Not well understood. It's in that place of the kind of the mystery of consciousness. I mean, it's just this amazing mystery. I don't profess to really, understand all the ins and outs of it. I love to follow physics. I'm not a physicist. But what I am is I am totally open to possibility of things. There's a lot of things that I don't know about, and I don't have to know about and be able to explain it. And I just kind of bask in the awe of, oh my gosh, observing what happens. Yeah. So these kind of processes are sort of like that. It's just like they are weird things that work.
Okay, so can you explain that a bit more about how the time frame of how our processes work in terms of quantum physics?
Yes. Yeah. So let's then talk about the TBI process. Is really what you're asking?
Please. Yes.
What we are doing with the TBI process, the TBI protocol, is the therapist is bringing the person's consciousness back to an earlier point of time, in what I call their fourth dimensional body. So if you think of us as, we have a 3-dimensional body, that's pretty clear to people. But if you think of us as being a human being through time, that's what I think of as our 4th dimensional body. So we're really sliding the person back, and there's a number of ways we do that in the therapy, to a very, very, very early time in the development of that particular human being, when the matrix, if you will, for lack of a better word, that will form and become the brains is actually forming. No. And what we what we see, Karen, or what is, as you well know, being involved in this, is that if there is trauma at that very early developmental event of laying down the matrix of what will become the physical brains, at this point there really is no physical brains yet. If there's trauma back in that developmental moment, the physical brains that then develop in that person are more susceptible to physical trauma versus more resilient. I really like the way that Dr. McFedrich explains this. He says, if you take 10 different people and line them up, and we've never done this experiment. I just want to make that clear. This is just a thought experiment. So if you have 10 different people and line them up and take the same, 10-pound brick or 20-pound brick or whatever, and drop it with the same force on all 10 of those people, you'll get 10 different outcomes of how much trauma there is or is not there, which has to do with the underlying resiliency or susceptibility of those particular brains. So, and that, as far as we can tell from our research, is what's getting laid down, or that resiliency or susceptibility is what's happening back at this very early moment in time. So what we do in the therapy is actually bring the person's consciousness back to that time, and through pretty standard trauma therapy release techniques, release those layers of trauma at this very early time. And then what we notice happening is that echoes forward in time to basically make their brain more resilient in the present, and so the symptoms that their brain was manifesting now shift. Okay, and so in one of our case studies that we have, actually this was the woman that you worked with, if you remember, Barbara, that I alluded to deafness. So she was deaf in one ear after her traumatic brain injury, and she had tinnitus as well, ringing in her ear. And you worked with her, was it within like 60 minutes or 90 minutes?
10 minutes.
10 minutes. So as you were doing that, in 10 minutes, boom, her hearing's back.
Yeah, and it was incredible.
That is absolutely incredible. And there's nothing we have in conventional medicine. Like I said, if someone has deafness after traumatic brain injury, well, she did rehab. Yeah. How long had she been deaf after her traumatic brain injury?
Yeah. So can you tell us some of the other results that you've seen on the project, Mary?
Sure. So getting back to that same patient, Barbara, she also had some decreased range of motion. She couldn't use her arm all the way. That came back. She had already done a lot of rehab from her original injury. So, and how long had she, before you saw her? What was
about 20 years.
20 years.
She had her accident,
Right.
Yeah.
So she had, she'd gone through conventional medicine and rehabilitation, as I remember, right? And she'd basically plateaued. They'd, done a lot. She was, functional and such. But after the traumatic brain injury process that you did with her, her hearing returned, her tinnitus went away. She was able to walk without the cane, or the stick, as you say that in the United Kingdom. Her range of motion in her arm improved, as well as more subtle things that would not be evident to people looking at her. How her sense of confidence and ability to go out there and interact with people. That is something, it's kind of this hidden things that very frequently happens with people with traumatic brain injury, because their brain isn't really processing, and they tend to be kind of, backed off and not going into social situations because, can I find the words? Will I stumble? There's this sense of things aren't working right and I don't want to engage. So that really shifted with her. And I believe she started to write a book that she'd always wanted to write and hadn't the confidence to do that until after the therapy. So that was her example. We also have the example of Micah. We have that case study. And he had multiple brain injuries. The last, I think, before you started working with him, was about 12 years he suffered with symptoms. And had gone to being very active, actually a researcher into alternative consciousness, a very, very bright man. And his body stopped working. He had fatigue. He was basically doing caretaking work is all that he could do, and kind of getting along. And his process took longer, but over about a 3-month period, the brilliant man that he transformed, the brilliant man that he was just came back, and it was really a wonderful interview that you and I did with him. So those are some of the results we're seeing, and we are at the ground floor of really testing this and looking at it. So the results we've had so far are absolutely, transformational, brilliant. To me, as a medical physician, I'm just in awe. I'm like, oh my God, this is amazing, and we've got to get this out to the people.
Yeah, that moves me on to my next question. What would you, if there are any doctors or practitioners listening to this video who work with people with TBI, what would you say to them as a doctor?
Well, I would say open up your mind to the possibilities. Certainly, I have learned that there are a lot of ways to assist and help people heal that certainly I never learned in medical school. With the working consciousness and some of these types of therapies, we are on the bottom floor of a high rise of what's possible in medicine. And standing on the shoulders of all the people that have gone before researching this. And in conventional medicine, we often tend to be in a box and think we're at the top of the high rise. We know all this stuff, but we really don't. There are so many things that are out there that don't involve surgery or medications. And this is one of them. It is hard to understand from, again, a Newtonian framework. I know that at least all the conventionally trained docs I know of, at least back when I went to medical school, we had to take physics. It's one of the prerequisites. Other than kind of understanding about quantum physics and how this is even possible from a physics standpoint, and it's totally possible if you're understanding quantum physics, I don't know why else I took physics. So open up your mind to remember the physics that you took, and try it out. It's not invasive at all. We actually do the calls like we're doing this Zoom call virtually. And we're not giving people any medication. We're not, sticking needles in them, trying new drugs, doing any surgery. We're basically just healing trauma that they have and allowing their consciousness to shift. So I would really encourage you, if you have a patient who has TBI and is stuck and plateaued, send them on over to us. We'll have a absolutely complimentary chat, see what they're interested in, see if they'd like to get involved. The other very exciting thing that we're doing that I absolutely want to mention is the way that it has to do with charging for this, the fee for it. And because we're so confident that this will help people, and it may not help everybody, that's for sure, but we do something called pay for results or charge for results. So at the beginning, if a person says, yes, I want to try this out to see if it will help me, we talk about what are the symptoms that are really affecting you that you've had after your TBI. And we basically guarantee that. If you don't get those results, then you don't owe us anything. If you get halfway there, then half of the fee that we negotiate.
Yeah.
So it's this, and it's not that way almost anywhere else in conventional medicine that I know about. You take the treatment, you pay for it, whether it works or not, and you even pay for it if you get complications and you're worse afterwards. So I'm very, very proud of Dr. McFedridge for insisting on that. It's a cutting edge protocol. It's going to be outside of most people's ability to understand. It's in medicine with our Hippocratic oath. It's first do no harm. And my sense is that there's only possibility for good here, because we're just enhancing and healing the trauma in a person. Now, if a person is uncomfortable and says, "Ooh, I'm comfortable with my TBI symptoms, I don't want to change," then I wouldn't work with them.
That's fine. No.
Yeah.
They're not the right.
They're not the right person. Yeah, they have to be just. I'll do anything to get my life back.
Yeah.
I'll do anything to improve these symptoms. Those are the people that we can really help.
We need.
Yeah.
So, what is your mission and purpose with the TBI Breakthrough that you and I have jointly collated together?
Well,
our purpose, should I say?
Well, the work we're doing in the Institute for the Study of Peak States is fundamental research into consciousness. So it's really a research and training organization. It's an international organization, but in the greater scheme of things, fairly small. People that are open to the next level. So we're really on the leading edge, or even the bleeding edge of
the cutting edge.
We are. Yes.
Of
what's possible in recovery and treatment of different diseases and morbidity processes. My mission, my passion as a healer, because that's how I'm called in the world, as a healer. I'm trained as a physician and now have these other tools in my toolbox, is to get these cutting edge techniques, starting with this one, and there's others we have in the pipeline, other possibilities, but with TBI, to really getting this to people that are suffering and struggling with these symptoms and have exhausted the conventional, medical model, done everything that they could, been doing rehab on their own in the background, and have reached this plateau and are still struggling, and that are looking for anything that can help them get their life back so they can continue to live their purpose in the world and function fully. That is my passion and my mission, to get this cutting edge technology out to them and make it available to the millions and millions of people that are looking for something so that they can reclaim their life and stop the suffering from the symptoms.
Okay. Thank you very much, Mary, for your interview this afternoon. I'm actually going to post a link underneath this video where people can hop on that link and schedule a free Get Your Life Back After TBI strategy call with me.
Fabulous.
And I look forward to interviewing next week.
Yes, very good. All right. Thank you so much, Karen, for your questions.
Thank you.
And thank you, everybody out there who is either listening live or listening on replay.
I think we've got a few listening live,
Yep. And we will see you later. Dr. Mary signing off. Bye-bye.